Hey guys, what's going on? Tony here. So in this video, I'm going to answer 9 questions that came in to me through an email. These are some pretty common questions, so I figured I'd answer them one-on-one, I'd record it and share it with the group. So let me take a look at question number 1. Setting up a personal and business EIN. So first, if you are not aware, EIN refers to Employer Identification Number. That would be consistent with a tax identification number. You can certainly become, or how do I say this? You can receive an EIN as an individual if you are working as a sole proprietor, working under your professional licensure. So if I wanted to be Anthony Maritato, physical therapist, I can apply to receive an EIN through the IRS so that I can hire employees, report income using that EIN as a sole proprietor. You can enroll in Medicare as a sole proprietor. You are not required to start a corporation. And generally speaking, when I'm talking to somebody who just isn't sure if this is right for them, I usually encourage them, just start with what you have. Don't go through the added expense of creating an LLC or some other professional corporation unless your state requires it. Start simple, start inexpensively, prove the concept, make sure this is something you want to do. And then once you have proof of concept, then go ahead and start to reinvest the money you're earning. I think too many of us are too eager to spend money we don't have, thinking this is how it needs to be done, when in reality, we just need to get started. So typically, if you're going to start an LLC, a PC, some other professional organization that's separate from you personally, you would receive or apply for a tax identification number, employer identification number for that business entity. If you're going to operate as a sole proprietor, you can use your social security number, or you can apply for an EIN for you personally as a professional. Question number 2, setting up Medicare for participating with Medicare Part B services. Yes, this is done through PICOS. Now, I've got a separate video out there that shows you what you want to do. I'm going to see if I can do this while you guys are watching. Looks like I can. So you're going to do a Google search for Medicare INA login. And what this is going to do, I'm going to actually, this will take you to the Identity and Access Management System. From there, you'll create your main login. That will get you access to the MPPES system where you'll apply for your MPI. For yourself personally, that's a type 1 MPI. And for your business, that's a type 2 MPI. From there, you'll create your PICOS account. PICOS is where you'll submit your Medicare contract, your initial enrollment for you personally, for your business. If there's reassignments in place, you can look up those reassignments from PICOS. You can see any previous PTANs you have through the PICOS system using their Medicare ID lookup tool. So everything kind of happens from that hub. But it all starts right here with the Identity and Access Management System from CMS. Let's see, getting enrolled into different managed care networks as a mobile therapy service provider. So typically, the enrollment process, really for any third-party payer, or I shouldn't say any, for many third-party payers, happens through a website. CAQH is the acronym for the website. And what this is a provider enrollment hub. But beside that, you need to go provider by provider. In other words, if I was going to try to enroll, let's say, in Aetna, so become a provider for, and then you can see here, Aetna, Medicaid, Humana, Cigna. Medicaid is actually not a good example. Let's go to Aetna. Join our network. Now I'm in Ohio. Obviously, I'm being geolocated to Ohio. But if I click on that, you would do it for your corresponding state. Blue Cross Blue Shield has corresponding states. You would just follow the prompts and they would tell you what the procedure is to become a contracted provider. Obviously, priority number one is you have to review the contract. You have to review the fee schedule, any other kind of rules and regulations that maybe you're not aware of or unsure of. Pretty much everything is going to be listed out in the provider contract. Now, there will be occasional contracts that there's a third party administrator involved. So, for example, for a while, Blue Cross Blue Shield was going through OrthoNet. OrthoNet was kind of the in between, the middleman who was determining medical necessity, reviewing charts, telling you how many visits you were approved for and whatnot. So there's always layers within these large administrative organizations. What I would recommend is get a copy of the contract before you sign it, review the contract, but then also try to reach out to local providers. Talk to other clinicians in your area that are doing what you want to do and see what they say. United Healthcare is a classic example. In most states, United Healthcare reimbursement for outpatient physical therapy services is capped at $50 to $55 depending on your tier level. You need to know that before entering into a contract because you might not be able to afford accepting a United Healthcare patient depending on your business model and the kind of care you are providing. So reach out to local providers who are contracted with the payer, review the payer contract, and thoughtfully think about your practice model before signing up for contracts. Also consider United Healthcare as another example. You can provide out-of-network services for some of their plans, which is far more profitable than trying to become an in-network provider. Let's take a look at what else we have. So CAQH is going to be the main hub, but you want to go to each individual payer website, go to provider enrollment, see what the requirements are, and go from there. How the cash practice will work, and how about referrals? So every state is going to have their own version of direct access. Some are more liberal, some are more conservative. I came from Florida. I haven't practiced in Florida for over a decade, but I can tell you at least back in the day, while yes, it's true, you can treat someone for 30 days. If they have already been, or at least at the time that I left Florida, if they've already been diagnosed with the condition that you want to treat, that kind of removed the 30-day guidelines. So a classic example would be somebody with low back pain or persistent shoulder pain or neck pain or migraine headache, something along those lines. They were diagnosed maybe a year ago, maybe 6 months ago, maybe 5 years ago. They have a physician, they have a medical team, they have a diagnosis for the condition. They just haven't been able to receive the treatment that resolves their issue. They come to you seeking your care. If you're going to do this out of network or self-pay, that historic diagnosis should exempt you from needing any other supervision from the referring physician. Now, if you're going to bill Medicare, there has to be a physician involved in the patient's care. You need a signed plan of care. And this is something we go through in the course, so I'm not going to get into it too detailed right now. Medicare does not require a physician referral, although it is encouraged to support medical necessity. You can find that in CMS Chapter 15, Section 220. But Medicare does require there be a physician's signature that certifies your plan of care. You are not able to submit a claim, although you may have direct access. Medicare will not pay for a claim unless there's a physician signature or another qualified healthcare professional in the eyes of Medicare signing the plan of care that allows you to treat that Medicare beneficiary. So it's one thing to be able to treat them, it's another thing for Medicare to pay. And different payers will have different guidelines, so you always have to understand the interaction between the payer guidelines, the state guidelines, State Practice Act, and what you're able to do. Same goes for supervision of assistants and other ancillary services. Pay attention to the State Practice Act, the payer guidelines. So which documentation billing software do I recommend? I mean, this is a loaded question. Absolutely it's going to change with time. It's going to change on your practice model. The big kind of thing that the priority that I always focus on is access to your information, regardless of what platform you choose. And you'll choose different platforms as your business grows and changes. But regardless, you need to guarantee you always have access to your information, your patient data, your history. And knowing that you're probably going to switch platforms at some point, you want to know what format that data is going to be delivered back to you if you leave a platform. So if I go from WebPT to HeNote or to HelloNote, I need to know, am I going to get data that I can import into the new platform? If I'm going to go from HelloNote to in-house like a G Suites account, am I going to be able to access that information? Am I going to have to keep paying for the old EMR that I'm not using anymore? How is the information going to be accessible to me? That is the top priority. The past medical information on your patients, how you grow your practice, all of that is part of the business, and you need to protect that. So I can't really say, again, I'm going to default to whatever is the cheapest and easiest, the most secure. You need to make sure that you can guarantee HIPAA compliance, you can guarantee the security of the information. So there's nothing that says it needs to be electronic. You absolutely can do paper charts. We still utilize paper documentation for daily notes, progress notes. We have a hybrid model, some paper, some electronic, but top priority is I have access to the medical information on my patient. It is protected and no outside eyes can gain access to it. And it's relatively affordable. The system we've created is affordable long term. I'm not tied into anything. Um, Policies and procedures for mobile therapy services. Really, there's not that much of a difference between mobile or brick and mortar. There's policies and procedures. You start day one by creating them yourself. You look at, you know, how you're going to do things. What policies and procedures are essentially the skeleton of your business. The services are the muscles, right? Muscles won't function without bones to pull against. Bones and muscles work together. So you need to figure out when I'm going to answer a new patient call on my phone. How am I going to answer it? What am I going to say? What questions do I need to ask? That is the birth of your procedure. And then you create a policy around that to ensure, what are you going to measure to make sure you're accurately getting the information you need. How are you going to establish updates and reviews? Mistakes will happen, right? Mistakes will happen. How are you going to create a system or a policy that identify the mistake, resolve the mistake, and prevent the same mistake from happening again? These are all things that you're going to spend the majority of your time on as a business owner. When we say work on your business, not in your business, that's what we're talking about. We're talking about go through every step. If you have a brick and mortar clinic, how are you going to clean the bathrooms? Who's going to clean the bathrooms? What metric are you going to use to judge whether the bathrooms have been cleaned to a specific level? This all needs to be written down, documented. These are your policies and procedures. And then once you have the resource, once you have the money, once the bank account is growing, you reach out to the real professionals. You look at Nancy Beckley. She has a website. She's selling policies and procedures. But I would tell you that unless you do it yourself initially, buying an external resource is never going to be as effective and powerful as creating it yourself. I can show you as a patient how to lift weights, but unless you lift the weight, you're not going to get the same amount of benefit. Now, lifting the weight without the knowledge isn't going to give you as much benefit. And that's the compromise here is you create your own policies and procedures, you do the work, then you reach out to an expert like Nancy Beckley, you buy her resource, and then you bring the two together. That is the ultimate recipe for a successful long-term practice. How to market, there is going to be no limit to the opportunities you have for marketing and growing your practice. I would say something like this really requires a specific understanding of your practice model, what it is that's important to you, what it is in the patient experience that you're crafting, and then how do you get that message? Communication and messaging is everything. Certainly, some of the big picture ideas to keep in mind is if you're exclusively marketing an insurance-based practice, it's a different clientele you're trying to communicate with, and they have different priorities. When I use my practice as an example, we're in network with all payers, but we also have a hybrid cash-based practice within our practice. We started completely out of network, all self-pay, and then we migrated into 100% in network, and now we're kind of migrating back out a little bit. But the idea is my priorities to my prospects, my potential clients, I focus on convenience. I explain to my patients that there is, really loads of flexibility in scheduling. You can schedule early, you can schedule late, you can cancel last minute, you can reschedule. I'm never going to penalize you for changing a scheduled appointment. So we focus on convenience, flexible scheduling. We focus on guaranteeing no surprise billing. Nothing tarnishes a physical therapy experience more than receiving a $300 invoice you didn't expect 6 months after care was delivered. So we guarantee that none of our clients will ever receive an unexpected invoice. We will never provide services without the client fully being aware of what the cost will be. And we provide a personal guarantee that even if things change on the insurance side, we are committed to the pricing we established from day one. So we eliminate all doubt about the potential cost. And then finally, the whole idea is, we promise that it's an enjoyable experience. We understand that the clients we are receiving, they're not necessarily, in the gym every day. They're not necessarily playing sports every day. They tend to be more of a sedentary population who's experiencing pain. And our promise to them is we won't increase that pain. We might not guarantee that you're going to get better, but we guarantee that we won't make it worse. And if we can't treat you, we can refer you to somebody who can. So those are our three priorities. But anyway, marketing is going to come down to your specific message, crafting your message, understanding your target demographic. And that is an entire module that we'll get into another time. And then, of course, telehealth. The big thing to remember about telehealth is it's been around for decades. People like Rob Vining and others have pushed the envelope as far as they've been able to. Right now, we have this short window of time. Many of the payers are accepting telehealth visits through the current crisis, but there are plans to stop allowing telehealth visits. And so, it's one of those things that we need to understand what the rules and regulations are right now, but also keep in mind that they are forming and changing day to day. So if you have more questions, if you have more, thoughts or ideas, my purpose in this, the information is widely available. My goal is to organize and package the information in a way that's useful for you, help direct you to the real resources that are out there, and then share different ideas, different perspectives and concepts that maybe you haven't had experience with, and that might trigger you to create your own ideas. It's just like when I have a student and I'm a CI, my top priority isn't to make that student treat a bunch of patients. My top priority is to help that student get inside my brain, understand my thought process, and from there, take the information, accept the stuff that resonates with that student, reject the stuff that doesn't, and then take it and use it as a foundation to grow upon so that they can create their own concepts. You are creating your own business. That is the top priority. Use what is existing as a model, but then craft your own patient experience, craft your own business model, and do it based on your priorities. What are your long-term goals? So guys, this was 9 questions. This was an email that came in. I promised a video response. Here it is. If you have specific questions that haven't been addressed yet, shoot them to me in an email, message me through Facebook, find a way to communicate with me, and I promise that I will do my best to answer your questions in a public format so that others can benefit from the knowledge and information. As always, Thank you for watching. Support the channel by subscribing. I'll catch you guys on the next video.